Hello, everyone, and welcome to this session of the AI Nurses Network webinar series. We've a lovely colleague with us today who's a Clinical Safety Officer and CXIO at Bradford District Care NHS Foundation Trust, and she's going to tell us a little bit about what she's doing with AI.
Hi, good morning, everybody. I'm Misbah Mahmood, and I'm a midwife by background. Thank you so much for inviting me onto this webinar.
Great. Well, can you tell us a little bit about how you got interested in AI and how you got started?
Yeah, so my interest in AI developed gradually, really, through my clinical work as a midwife, and then stepping kind of into like leadership and digital health roles. And quite early in my career, I saw firsthand the kind of the pressures that clinicians face and the repetitive tasks that we were doing. And quite often, like I always reflect on, as clinicians, we were doing quite a lot of the administrative tasks around seeing our patients. And used to think to myself, like, surely there's a quicker way of doing this. So I became increasingly interested in how digital solutions could really improve both patient safety and staff experience as well. And as I moved into the role of a such as my CXIO role and clinical safety officer role within a mental health and community setting, I was exposed to the wider digital ecosystem, including electronic patient records, data systems, emerging AI technologies. It kind of just came from nowhere, really, didn't it? It was just one day everything was AI, wasn't it? And I think as well, it was like it's time to like manage people's expectations as well, because I feel like it was as if it was like the nice new shiny thing that was going to fix the world. And I always say like digital's an enabler and there's people and process around it. So it was kind of hard to manage the enthusiasm alongside the reality
Sure.
as well. And then also my involvement in clinical safety has really highlighted the importance of ensuring that any digital or AI system is safe, effective, evidence-based and designed with patients in mind. From there, I began engaging more actively in research, kind of, attending webinars, speaking to people. And I think, it's really good speaking to a supplier, but then it's good to kind of look at the network and engage with the colleagues within the NHS that have used something, implemented it. And I suppose it's quite unique. So obviously, being in a mental health setting as well, it's nice to speak to people that have implemented AI in a mental health setting. And I think the increase in appetite is definitely there.
Great.
I'm really interested to see kind of what the future brings.
Yeah. Is there any specific AI tool that the trust is working on introducing at the moment, or have they brought stuff in already?
So we're using Copilot at the moment. So we've got quite a few people that have got a Copilot license at the minute, and that's it really. We're looking at AVT, but we're kind of still. I think for me, it's building the foundations and kind of looking at, where is our system, where is our EPR, where do we want it to go, and kind of what are the risks within it, because AI is like anything, isn't it? Like you're layering over a solution, you're layering something over um, potentially not weak foundations. So we're kind of like looking at the roadmap to AI and how we can get there and making sure that it is going to be successful once we implement it. And I think the really good thing here is that we are looking at future-proofing solutions. So when we are looking at a solution that we're going to bring in, we're then thinking, oh, well, actually, is there an AI element to this, or could AI help and support with this as well? And we do quite a few like rapid improvement weeks. And with that, we're always looking at, how can AI help us and support us.
And do you know how people are using Copilot? Would it just be kind of for meetings and kind of administrative support?
Yeah, generally it's administrative stuff, so like meeting minutes, and I think as well, just like sometimes like, drafting emails, writing paper, giving you like the skeleton of a paper, and then you can like pad it out and things like that. And I think it's taken people, especially within corporate services, definitely find it really effective. um and I think in terms of, like reviewing meetings as well, if you've missed a meeting and going back to it, you can go back to specifically, the bit that you was mentioned in, the bit
Yeah,
that you was
sure.
interested in, as well. So it definitely does save a lot of time.
Yeah, do you see midwives? I know there might not be many in a mental health trust, but yeah, do you see midwives using AI in their practice maybe in the near future?
Oh yeah, definitely. I think there is definitely scope for AI, and especially I think around the predictive AI as well, because we have a lot of women that have a lot of risk factors, and we have loads of rich data sets as well. Obviously, we feed into maternity services data set submissions, and it would kind of be really good to layer AI above that to look at the predictive values, because we know that like women from ethnic minorities are more likely to die with childbirth, or have mortality and morbidity as
Oh,
well. And
yeah.
so it will be really good to kind of see and be able to predict some of those factors as well with the rich data set that we've got. And I think AI would really help to support that. And again, also, like, I know that we've talked about previously in the past with AVT within a delivery suite setting or documentation purposes as well. And I think that will be really good as well, because there's a lot of scrutiny on maternity services at the moment, and everyone is really worried about litigation, defensive practice, and it would really kind of help with that documentation side of things as well.
Yeah, great. Have you any advice for maybe midwives that maybe want to introduce an AI tool into their practice? What's the best way to go about it?
I think it would. I think the best way to. I think what I would do as a clinical safety officer is
Mm.
is start with the clinical safety documentation, because
Sure.
throughout, when I've been looking at some AI solutions and some of the information I've been provided by suppliers, I'm like, this doesn't give me much hope. But I think reach out to the suppliers and have those conversations, because quite often they've marketed something quite broad, don't they? Whereas it's nice to have those detailed conversations. That's what we've done as well from a mental health perspective, is reached out to the suppliers and had those conversations, and how would this work in a mental health setting, and that's been quite good. But I would definitely say go out, speak to people, and also speak to peers as well, because there's people around you that have probably implemented something, and stuff on LinkedIn all the time, isn't there, that have implemented something, and it's good to kind of look at those lessons learned.
Yeah, I guess a lot of the trusts are introducing AVTs, and I know
Yeah,
the NHS England have the National Registry now, so hopefully that'll make
yeah,
it a bit faster to
yeah.
introduce it. But yeah, there's lots of good case studies I think that you can learn from different parts of the UK and internationally as well. Um, yeah, I guess where might AI go in the future? I guess I mean AVTs is the big kind of AI technology at the moment, but yeah, can you see any other trends happening that might impact on midwives?
I think the the RPA side of things will really impact on midwives, and I think it will really release a lot of time to care as well. So some of those, and to be fair, when I was working at Leeds teaching, we did have some RPA processes that really helped with our. So, for example, when we did a new booking, the referral would come in, and then there was an RPA process that would register it onto our PAS system, update the address, demographic details, and that was a previously used to be a manual process. Um, but that was done by an RPA, and I feel like the RPA will get more, and then intelligent automation will really start to take over. And I think that's really where we're going to see the productivity gains, and also the staff and patient benefits as well.
Yeah, I agree. Is your trust using the NHS Federated Data Platform yet, or is that coming to
No,
Bradford?
not at the moment. We are hoping to start using it, I hope soon. But yeah, not at the moment. I think it's quite difficult when you're not in an acute trust. So I've always worked in acutes, and obviously like coming here as well. The it We don't get as much funding as you would in acutes. So the spotlight for the FDP is mainly on acutes, but we are looking at trying to implement it. And I think just on that as well, I think the data side data quality needs to be improved as well.
Yeah, what kind of data quality issues will you see in a kind of a mental health trust?
The normal ones that you'd see
Mm,
in anyone, like are not not outcoming appointments, is a big one at the minute for us. Um, the registration process, the issue we have here is we have a lot of services that we cover, and we don't have a single referral route in. Everyone receives referrals in different ways, so sometimes it's then difficult to manage your demand on the services and capacity and those kind of things as well. So I'm looking at more of um, a single kind of front door model into services, and then layering AI above that as well. So it's the referral comes in, and then we have an AI and RPA process that can then pick up that referral, analyze it, send it to whichever speciality it needs to go to. Because at the minute that is very much a manual process, and the thing is as well, we only work 9 to 5, whereas
sure.
AI works our 24 hours.
Yeah. Yeah,
The
trying to
robots don't get a day off.
no, trying to standardize stuff, yeah, definitely helps because it makes the rollout of
Yeah,
technology a bit easier.
yeah.
That's yeah, there's lots of specialized services. Great. And are you hoping maybe to do some research around the use of AI in the trust? Because I guess maybe staff have a whole range of different views on it.
Yeah, definitely. So with the AVT, we are wanting to use it in our first response calls, as well because we have a high call abandonment rate. So we're hoping that with the AVT, that will really help to reduce that and help us pick up more calls. So we are wanting to do some research and kind of evaluation on that because I believe that we are probably one of the first trusts that are wanting to use it, for that setting because most of the time it's marketed as like in like a consult one-to-one like consultation type setting. So we are hoping to kind of do some research on that and kind of evaluate the, I suppose, the patient's experience, but also the call handler's experience as well, because obviously it's quite an intense role that they're doing. And the one thing that I have didn't quite appreciate actually before I came here is with physical health, when you ring 111, you have all the other options to go, but with mental health, it's everything comes through to us.
Ah,
From somebody in crisis to somebody just wanting an appointment, everything comes through to us. So we are wanting to hope to kind of really improve that service by first of all introducing AVT, but then also introducing intelligent AI at the beginning. So it's kind of like managing the calls, and making sure that we are seeing the people with the highest priority, speaking to the people with the highest priority first, really. Because
yeah.
otherwise it's difficult to kind of manage the demand on the service.
Yeah, definitely trying to improve the triaging process would be helpful because both for staff and for your service users, because it's a lot of high volume and a lot of complexity in the different cases.
Yeah.
Great. Great. Do you collaborate with other trusts in the region around AI and introducing technologies?
Yeah.
Mm.
Yeah, so I'm part of the digital health CNIO um, networks. I'm a panel member on the CNIO advisory panel. Obviously, like going to all the events like Rewide, etc. as well. It's really nice, and I think what I really liked this year at Rewide and at these events is initially I feel like it was all like AI is going to fix the world and it's going to do all of this, but I feel like now the message is quite strong in the sense of implement with caution kind of thing, like the safety element of it, which I think people are now getting more on board with, and kind of slowing it down a little bit, as well. But then there's still the fear. And I mean, I heard it yesterday with somebody saying, is AI going to take over my job? And I think it's really important to remember that your clinical expertise is the greatest strength, and that will never be taken away really. Like even with AVT, when I was just doing hazard logs yesterday, the mitigation is as a clinician you are responsible for checking your documentation.
Yeah, sure.
So the AI will kind of give you an extract, but you then have to review it, and you're responsible for approving that and putting that into the patient's record.
Yeah, yeah,
And I think it's really important to remember as clinicians that your clinical expertise is still more important, and nothing can really replace that.
yeah, I agree. Yeah, I think that's a nice sentiment to wrap up on because, yeah, I think the world of AI, it's changed so much even in the last 2 or 3 years. It can be very
Mm,
overwhelming, constant stuff in the news about AI. But yeah, I think the human element will always be central to everything we do. And as
yeah.
you said AI is just there as a supportive tool.
Yeah, definitely. It's an enabler, isn't it? It's not
Yeah.
a replacing or fixer. It will enable it. And I think it was really interesting what I heard somebody say the other day, like ChatGPT, Copilot, these things, they're just answering your demands. So whatever prompt you put in, they're just responding back to them, as well. So it's kind of like you've got to be really careful with what you're asking, what prompts you're putting in, and those
Yes.
kind of things, as well.
Yeah, having good prompting skills definitely helps you prevent getting
Yeah,
loads of rubbish, rubbish
I
in,
feel like
rubbish out, as they say.
Yeah, I feel like I'm always having like I'm like to everyone. I'm just having a conversation with Copilot. I'm like, how do you do this and what happens then? And you end up having like a full dialogue.
Yeah, I find it really funny when you ask it maybe to generate an image and it's some if you look at it in a bit of detail, like there's something funny in it, like it's someone has an extra finger or they've changed somebody's face or there's something in there
Yeah,
that you didn't expect and you're like, oh, why did you add that in?
yeah,
Yeah, it's really interesting, but I'm sure the models will improve over time and yeah,
yeah,
the
definitely,
outputs that
yeah,
they
definitely. I
generate.
think I don't think I generally don't feel like it's going anywhere. If anything, I feel like it's getting bigger and stronger, like the demand for AI. But I just think we need to just uh, be cautious with it.
Definitely. Well, it'll be great to check in 12 months' time once you've rolled out maybe
Yeah,
some
definitely.
AVTs and see where
Yeah,
you're at in the trust, because I appreciate a mental health setting is very different from a big
yeah,
acute trust. And yeah, I think AI there would be really, really valuable in some of the areas that you mentioned.
yeah, definitely.
That's great. Well, thanks so much for your time, and we'll catch up soon.
Yeah, brilliant. Thank you for having me.
You're welcome.